Let
Yeah.
me get to John Rundback, who's had the most experience with taking care of COVID patients and in the sense of paid the highest price for that as well, direct exposure. And if I can share your story with this group, I think it would be very interesting for people to hear how you've experienced COVID. You're in New York and in a high density population area as well. And you've experienced this firsthand. Tell us a little bit about what's happened to you, John.
Thank you, Tony. Thanks for inviting me to participate, and God bless to everybody out there. Stay safe, please. So I'm going to sort of tell you two things as part of my personal story, and obviously I'm sensitive of time. So I'm a COVID-19 patient, recovering, and I think there's a real warning here in the sense that I probably was exposed on or about March 4th or 5th, probably by a patient who walked in. We have 3 hospitals and 2 outpatient centers in New Jersey and New York. Our biggest hospital is actually in New Jersey, in Teaneck, where we now have 100 cases, 25 patients on vent. It's only a 350-bed hospital. So we've been overwhelmed. But clearly, prior to this surge and this outbreak, it was in the community, and we didn't even know. So presumably, a patient walked in, and just in office hours on one of those days, I was exposed to that patient, had no way of knowing, to not wear a mask, when examining a patient and talking to them, probably one of my critical limb ischemia patients. I know for a fact that one of those patients who had a painful, non-healing ulcer, we treated successfully, was readmitted the following Thursday with respiratory distress, hypoxemia, and COVID. And subsequently is on a vent at the hospital. But of course, that wasn't his problem. He had a little low-grade fever, but of course he had an infected foot. And we had no way of knowing. So I think that's sort of the personal warning. My experience is that, we have to assume we're getting infected by every patient walking in. So the reason to really only do elective things is that we're exposing ourselves and then exposing others. We just don't know. We're being exposed in ways that we can't possibly anticipate. And I can tell you firsthand, it's a bad bug. I mean, I'm on the mend now. I'm afebrile for 48 hours, but there were 5 days there where I was really very ill with high fevers and bad cough. And fortunately, I recovered. The second part of this is that other than those 5 days from Thursday through Sunday, I've been using my time at home taking care of patients, triaging patients. And this will transition, Tony, really very nicely what you do. So, we have a very active practice, particularly a critical limb ischemia practice. You can imagine at 5 centers, there's a lot going on. And what the hospital started doing is just canceling those patients. And I pointed out, these are patients who have active wounds. They're in the midst of therapy. They've been treated recently. We can't just cancel their appointments. We need to have communication with these patients. So I've actually been very busy at home, taking the role for me and my partner and all my associates, calling every single patient and following up on them and triaging them appropriately and making plans. I'd love to hear your experience. We tried to institute 2 telemedicine platforms, but unfortunately, most of our patients are elderly and we're not capable to download the platform, and/or we're not give consent to telemedicine, which are 2 integral parts in New Jersey, New York. So in essence, I've just been speaking to the patients, providing good care, triaging them. And in the course of this, in the course of the calls that I'm taking, we've had over the course of my 2 weeks home, about half a dozen patients who are emergencies. Some patients who are following, and some patients I calls who we've had to send in. What we're doing is we're revascularizing what we can and sending them home, not admitting anybody to the hospital, trying to keep them out of the hospital as much as possible. So those have sort of been my lessons learned, both in terms of the risk to all of us, and secondly, in how we need to continue to care for our patients. CLI is it is not an elective thing. There are 300 amputations every day in this country. So it's a serious matter, and we just have to be really on top of our patients and cognizant of their current status. Delay if we can, but don't delay if we must.